You said that healthcare organizations should have a digital strategy and that a digital strategy includes documentation as structured data instead of textual data. But it seems that structured data is sometimes too limiting. Where's the balance point between the two?
Great question, Anne. I see that healthcare providers' key role is in translation. It's translation of a patient's complaints into structured medical concepts. It's translation of findings into structured terminology. And it's ultimately translation of that medical evidence into a management plan that fits the complaints and findings and that the patient can understand and manage. So we have that role of translation, and with every translation, there's always a risk as well of being wrong. So, and that probably leads us to that spot where the balance, where there's some unavoidable need for unstructured data in order to help us understand that uncertainty level. I think there's two places that unstructured data is required in healthcare documentation. First, in the chief complaint. This should be in the patient's words. The patient's complaint is not structured and shouldn't be. Capturing the complaint in the patient's words is valuable. It can help us identify when our initial translations are wrong. It can help us learn the range of concepts that patients mean when they make certain complaints. The second place is that we have to commit to a set of assumed translations of the complaints and findings, and come to a diagnosis and treatment plan. Now, every diagnosis and treatment plan is provisional to some extent. I mean, there's always a thread of doubt that perhaps I've gone down the wrong path. Sometimes it's extraordinarily the likelihood is extraordinarily high that I'm right, and sometimes it's extraordinarily low. And unstructured data can be the best way to express that. So that element of uncertainty sometimes it can be expressed in structured terminology, but may be best captured with a textual entry to give the needed color to the decisions made. I think the key to using unstructured entries in healthcare efficiently is to always think brevity and clarity. An excess of textual entry in healthcare data is inefficient, and a volume of text tends to hide or obscure important concepts and historical facts. Thanks, Anne. Great question.